In this video, I'm going to talk to you about how you may choose to use the birthing pool to help you feel comfortable and more relaxed and to cope during the birthing process. If you're planning a home birth, then you will need to look into your options for being able to hire a pool. If you're planning a hospital birth, at Harrogate we have one pool. When you ring to let us know that you're ready to come into hospital, it's probably worth letting us know should you plan on using the birthing pool. If the birthing pool room is free, then we can allocate you this room to receive your care in. It could be that as you ring, that actually a lady is just coming up to birthing in the birth pool, and that as you arrive, she's maybe an hour after having her own birth. You may then be ready to use the pool straight away, or you may try some other options to help you cope whilst we prepare the birthing pool. Ladies are really understanding, so if a lady has birthed in the pool and she's found it really helpful and have been of use, then she's really understanding if there is another lady coming in who wishes to use it also. What we would do in this instance is an hour or two after that first lady is birthed, we would then ask if we could move them as a family into another room, so we could then clean and prepare the pool for the next lady who wanted to use it. There's very few occasions I can think of where somebody has really wanted to use it and we haven't been able to facilitate that. It just seems to happen that, a lady finishes using it as another lady comes in. So how does the birthing pool help? Well, the birthing pool helps that it's going to support your weight, it's going to give you a feeling of buoyancy, and the warm water is going to help you to feel more relaxed and at ease in the water. It will allow you to get into lots of birthing positions that are going to be upright, forward and open, the swinging from the chandelier positions. So you can squat, you can go on all fours, you can rest on your side, you can kneel. If your bump is under the water, then you're getting that therapeutic effect from being in it. The temperature of the water will be kept to around body temperature at the point your baby is born, but until that point it will be kept to a comfortable temperature for you. So before you get into the pool, the midwife will ask you to have a feel and to let us know whether it feels just right or whether you could do with a little bit cooler water or you want it a little bit warmer. Getting your bump submerged underneath, and many ladies as they enter the birthing pool, you can just see them instantly sort of almost relax and melt into it. If you are birthing in the hospital, we would ask that your birth partner doesn't get into the pool with you. And this is for two reasons. One being infection control, but another good reason is that the minute your birth partner gets in the pool with you, it takes a significant amount of space up, which somewhat defeats having all that space to move around in. Our pool room at Harrogate has got some lovely lighting in it, so we can get those lights set to perhaps your favourite colour. So it goes through many of the spectrum of colour, so maybe purple is the colour that you like to be in and find most relaxing, or maybe you like an orangey yellow colour and it reminds you sort of that invigorating quality of being outside in the sunlight. So ask your midwife and we can adjust this for you. There are certain times where we may suggest that the pool is not the safest option for you or your baby. Perhaps you've had some complications of raised blood pressure during your pregnancy. We would then advise the pool is not a safe option. Perhaps your baby has passed significant meconium into the waters before birth. We are likely not to advise the pool for use. So if the midwife does suggest it's not safe, she would explain her rationale for why and hope that you understand that. Many ladies who use the birthing pool to cope during the birthing process don't want to get out, and they would then choose to birth their baby into the water. At this point, we would ensure that the water was around body temperature of 37 degrees Celsius. The reason for this is, if you imagine your baby in one environment inside at 37 degrees Celsius, remember there will still be some water inside there as well, even if your waters are broken. Your baby then births into water of the same temperature and doesn't get that stimulation to take that breath until we bring them up to the surface of the water. As their face hits the cooler air, that gives them the stimulation to take that first breath. The midwife will guide you as to what position you birth in the pool, as to how your baby will come out. If you're birthing in an all fours position, your baby's likely to come out behind you. So the midwife would talk to you about how we would pass the baby back through. Women who choose to birth in the pool may like to catch their own baby, which is something really lovely to do, or you may want your birth partner to assist in catching your baby and bring them up to the surface. Don't worry if at the time you're all a bit fingers and thumbs and you're not quite sure what to do, the midwife will help you with that. But the pool is a great way of helping you feel more comfortable and relaxed and birthing your baby. If you deliver into the pool, the midwife will be wanting to keep an eye that as the baby's head is delivering, that it's very gently stretching the tissues of the perineum. Delivery into the pool is hands off, so the water provides the counter pressure that our hand would if you were on dry land. So the midwife will just guide you to allow the power of your contraction to deliver your baby's head slowly and gently. And this helps to reduce the chance of having a tear into those perineal tissues. It might be something that you haven't considered in your birth preferences, and at any point during your birth, you could ask the midwife for advice, and it might be that you've never thought about using the pool before, and the midwife suggests that you might try it, and you try it and you love it. The one disadvantage, as we said, is sadly we only have one, but more often than not, if you had your preference to use the pool, you are likely to get it. Saying that, if you decide to use the birthing pool and then decide that it's not for you and you want to use other forms of comfort relief measures, we are likely to ask that you then move as a couple into another room. So you're then not blocking the room, not using the pool and stopping another lady using it. So I hope you've enjoyed learning a bit about the birthing pool, and you may wish to consider this as one as your birth preference.